Audio settings, communicate, play test sound. Okay, that works. Speaker, mum's boobs look great. Hashtag ask JJ. There you go. That is the sort of thing we want. So, oh, it's working now. Is it Simone? Have I fixed it? I fixed it. Have I? 212, 212, testing. Is it this microphone? I don't even know if it's that microphone. Um, okay. Is it working, Simone? Thank you. That's why Facebook wasn't happening. Yeah, someone asked to request. I think that was a mistake with it. So yes, it's working. Okay, sorry about that. There you go. Technical glitches. I'll have a word with the technical team in the morning. So what? In case you missed that, Facebook, Danny's mum's boob looked great. So nice one, Danny. Thank you for that. I think that's probably related to me and the surgery rather than just a general comment. So I haven't got that many questions, but I'll do what I can with what the tools that I have, and I'm not going to moan. I'm not going to grumble about it. I'm just going to get on with it because that's how I am. Just get on with it. Don't make a big fuss about it. So let's without further ado, I'm kicking off. If you don't mind, if you have got a question, chip in. If not, sit back and relax because here's some doozies. Do we do face and neck lift? Good first question. That one reasonable question to ask for a plastic surgeon / plastic surgery clinic. Answer quite simply no, we don't. And I'll tell you for why. Because I specialise in breast and body contouring, and that is what I have done when I've been working in the NHS. I did breast reconstruction after cancer, and I often took a piece of the tissue from the tummy, which is basically like a tummy tuck. So this is an area that I'm used to operating in, and I've always operated in. And I personally don't do other stuff, being facelifts, neck lifts, Botox, rhinoplasty, nose jobs, things like that. So I don't do that stuff because I stick in my lane. It's actually quite common for plastic surgeons to do a bit of everything, and there's nothing necessarily wrong with that. I talk about that in my book over there on the shelf. You can't see on this strip. Yeah, I've written a book. Okay, because basically the book talks about choosing a plastic surgeon, and it talks about choosing a fully trained plastic surgeon. Even within fully trained plastic surgeons, there are also subspecialties. So if you have got a particular problem, it is good to see a surgeon who specializes in that. But for sort of straightforward surgery like breast reductions, tummy tucks, and breast augmentations, arguably not straightforward, but for non-complex, then it's not uncommon for plastic surgeons to do, faces, tummies, boobs, legs, a bit of everything. But I'm not one of them. So I just do boobs and tummies, so breast and body contouring. But face and neck lift ain't on the list, I'm afraid. So I don't do that. The other thing, I mean, we might get into it, but I need someone. I need to be able to help out because I've got other surgeons working at the clinic, and I need to be able to help out if there's any questions, queries, and things like that. And although I did in my training a lot of face and neck work because I was doing a lot of head and neck reconstruction after cancer, I then went down the breast route. So I haven't done it for some years. So that's another thing that I feel that I need to be able to help out. So I'm sticking to my lane, and that's my lane, breast and body. Simone has only just come on Facebook, and she's got 4 comments on already. I mean, that's pretty good going. Admittedly, 2 of them were no sound, and one of them was no sound, and 2 was that's better. But the 4th one is after a tummy tuck, how long are you bent over slightly for? Yeah, it varies, Simone, and it obviously you're aware that you are bent over, so a big bit of tissue is removed when you do a tummy tuck. I think I've got a question. Oh God, here we go. Simone, that's one of my questions. I wonder if that was you. Oh dear, oh dear. Anyway, it varies, and I normally say 2 weeks. So you come back for your dressing after a week, and then you're probably still a bit bent over, your back hurts, etc. Second week, you'll be feeling better. Normally, after about 2 weeks, you're starting to straighten up, but it does vary. And paradoxically, it depends on how tight your skin is. So someone who's maybe only had a couple of children, who's actually got good quality skin, it will be bent double more because their skin is tighter than someone who has had lots of children or has lost a lot of weight and the skin has really been damaged and stretched. So in those patients who have got a worse tummy beforehand, because the skin has been so stretched and so damaged, it's not quite as tight. So they will actually walk straighter quicker than the person who's maybe not got much of a tummy. So it might sound a bit weird that if you've not got much of a tummy, you're actually going to be bent over more than someone who's got a massive great tummy. But anyway, one of those things in life. But yeah, I'm going with 2 weeks, but as I say, it does vary between people, and it does vary about how much skin laxity you got and how much is removed, and it's always a balance with this stuff, whether it be a tummy tuck or breast lift or facelift or any sort of contouring surgery. We're closing the skin as tight as we possibly can because we want to give you the best result possible, but we also don't want to have wound breakdown. So you wouldn't be happy if you weren't, it wasn't tight at all and you could just walk around and say, I haven't had anything done. Obviously, the wounds will heal up brilliantly, but you won't get good results. So it's always a balance between giving you a good result, but letting those wounds heal. But it is along the side of being quite tight. So it does feel a bit tight. And that actually leads me on to my second question here, which is similar actually. Recovery time for tummy tuck. Will I be able to go up and about after? So specifically with this one, what I want to be specific about here is that will I be able to get about after 2 weeks? You know what? You'll be able to get out up and about after 2 hours. Well, maybe not 2 hours, but certainly one day, the next day, if you feel up to it that day, yeah, you need to get up and about straight off the bat. One of the risks of tummy tuck is DVT, which are clots in your legs, which can fly off into your lungs and form a PE, and that's a serious complication. And we take that very seriously, and we do lots of things to prevent it. But the best thing you can do to prevent a DVT is to move. So when you're not getting up and about, you need to move your legs and hips and bum and all that, but you need to get up and about as soon as possible. So as I say, if you don't feel up to it the day of the surgery, that's okay, but keep everything moving in the bed. But certainly up and about next day, definitely. So, you're not in bed for 2 weeks, you're up and about straight off the bat. Now, you are bent over and you are feeling a bit uncomfortable. So you're not going to be doing anything crazy, but you will be pottering about. But as I say, yeah, bent over for a couple of weeks would be normal. Liz K, initial and also surname. I'm booking a consult with you once I've got these blooming kids back to school. When's that, Liz? We've got a bit of time left, haven't we? We've got a few weeks left. Good on you, Liz. Good to see you. How long do you stay in hospital for a tummy tuck? That's a good question, Liz, because that has changed. It used to be 3 nights. Well, let me put it like this: we used to book for 3 nights back in the day, and because we booked for 3 nights, a bit like breast augmentation used to be overnight stay, and because people were booked in for that and were told they booked in for that, they would stay for that. But you don't need 3 nights, to be honest with you, Liz. And so I'd say 1 night. Did one yesterday, saw her this morning, right as rain, she's fine, drains out and home. So 1 night is now the norm. 1 night is the new norm, Liz, for a tummy tuck. If you don't feel up to it, if you've got too much in the drains, if there's any issues, you could be longer. So you might need to stay longer than 1 night, but 1 night I would say is the norm nowadays for a tummy tuck. The problem is, well, not the problem is, but the hospitals sometimes sort of book you in for 3 nights, so you feel like you've got to stay 3 nights, which is fine if you want to stay 3 nights, but you often don't have to. 1 night is normal now for tummy tuck, Liz. And thank you for asking a question. Not only that, she's followed up with another one. Would you believe it? Liz, okay. Is muscle repair and Mons lift included in a tummy tuck? Oh, good God. Stuff's gone on Instagram and I've completely not noticed it. Oh, my love. Hold on a minute. What is... Right, sorry. I've lost track of this chat. Instagram. I think I pressed something, so therefore I didn't... Right. I'm going to keep it professional, and I'm going to stick with the Facebook question. Then I'm going to see what's going on Instagram. Kicking off now. This is what we need. This is how it goes viral. This is what makes or breaks social media influencers like myself. So muscle repair and Mons lift included in a tummy tuck. Muscle repair, yes, Liz, is a standard part of it and usually needed. So it's called muscle repair. It's not really repair because the muscle's not sort of, damaged. The muscles are just pulled apart a bit. The rectus muscles, your six-pack muscles, they're straight line muscles that go down either side of the belly button, and they're usually a bit apart, known as diastasis or divarification of the recti. So yes, bringing them together is an integral part um, of the tummy tuck. Mons lift, less so, Liz, less so. I normally say I will do what I can to the mons. Now the mons is the area of where the pubic hair is. It's the area sort of centrally, the lower part of the abdomen. So if there is excess in the mons, it's always good to notice it pre-op, because you're limited as to what you can do to the mons when you're doing a tummy tuck. You can't really do a significant mons lift at the same time as doing a tummy tuck because it will make your scar drift up. So you can do a bit on the mons. If you're having liposuction, you can do a bit of liposuction. You can maybe take some of the heaviness out of the mons. But if you've got a lot of skin in the mons area, it's hard to do too much to it, and it might be required as a second stage. So if you've got if you had significant weight loss, which is usually the sort of candidates who require this, then you've got a significant stretched skin in the mons area, that might need to be addressed as a second stage. And it's important to have that conversation before the first one, because you don't want to have your tummy tuck and then look at this mons and think, what the heck have you done there? So it's important to recognize if it is there pre-op, because some people don't recognize it. So tummy tuck, muscle repair, definitely. Mons lift, limited mons lift can be done. And I've got to be honest with you, Liz, most people don't need much. Very rarely need to do a mons lift. Hardly ever. Can't remember the last time I did a mons lift. It's not a common procedure. It's for massive weight loss patients. Oh, Danny's mum here came home today. Very pleased. Thanks. There you go. Sue's came home today. Good. That's right. I wondered who your mum was. Good. Excellent, Sue. I was very pleased as well. I think it's a great result. How often do you have to replace your implants? I had mine by yourself 5 years ago. So pleased with my results. So the answer to that is that if you need to have your implants changed, you will know about it. So that's the first thing to say. Now, I would say I always follow up my patients. So I hope I've offered you a yearly follow up. If I haven't, you're more than welcome to come to the clinic every year for a checkup, see how you're getting on. Now, a lot of people don't do that, but it's fine if you don't do that. And the reason it's fine if you don't do that, so they're not bad people. I just like keeping an eye on patients. So the reason it's okay if you don't do that is because if you have a problem with your implants, you will know about it. It's unlikely to be something that the doctor will pick up. So you don't have to have follow-ups. You don't have to be examined. If you have a problem, you will know about it. And the problem, probably the most common problem, is capsular contracture, which is the implant going hard. And if that happens, you might want to have it changed. But if that happens, you don't have to have it changed. So I normally say it takes about 5 or 10 years for that to happen. So it might not be there yet, and it might not be there for another 5 years or more. It could be 10, 15 years, 20 years. So and as I say, you will know about it. So you're welcome to come to clinic for a checkup. It'd be lovely to see you. But if you're asking when do my implants need to be changed, you will be the judge of that. If you haven't got any problems with the implants, they don't need to be changed. The other thing is looking out for lumps or swellings, which you should look out for anyway, because you've got breasts there. So if you've got a lump or swelling in your breast, you need to get it checked out. So if you've got an implant in, it's always best to get the implant checked first, because they always say, oh, you've got implants in. So if you get a lump or swelling or hardening, come back and see me. If you haven't got a lump or swelling or hardening and they're fine and you're pleased with the results, you don't need anything done. But as I say, I do offer yearly follow-up for everybody, so you're welcome to come back if you're not still coming back. But that's the answer. They don't need to be changed. The implants have got a lifetime warranty, but they can start to go hard after about 5 or 10 years. But if they're not going hard, go with it. Who cares? Carry on. Wellness Therapy Clinic. What is your opinion on manual lymphatic drainage pre-stroke, post-op? Thanks. I haven't got a strong opinion about it, Wellness Therapy Clinic. I haven't got a big experience of it. I think at worst, it's quite nice. It's nice to have massages and what have you. I think it's a nice feeling, and at best, it might aid healing, and it might aid the healing of the wounds. I don't know if there's much evidence for it. I don't particularly recommend it to people, but if they ask me about it, I say, yeah, great, go for it. But it's definitely, I think it's a fine thing to do, and it would be if we had a lot of people talking about it and doing it, then we might sort of incorporate it into the clinic. But we don't have it at the clinic at the moment. But I think if someone knows someone who offers it, I'm like, yeah, go for it. It might do something to the healing. It might not, but even if it doesn't, if it's a nice feeling and you're feeling like you're getting your tissues moving and everything, then it might be a good thing. So not a strong view on it, but happy to be um, sort of view to change on that. But it's not. I don't know anyone around who does it or offers it. But if you do wellness therapy clinic and you're local, get in touch, DM me, and we can talk. Send people your way, see if it's a good thing to do. But yeah, haven't got a set pathway for it at the moment. Blooming Interior, thank you very much. I didn't realize I could come back every year. I'll definitely book in to come and see you soon for a checkup. Thank you very much. Yeah, absolutely. Sorry, it's my fault then, isn't it, that I don't tell you that you can come in every year? Blimey. Note to self: tell everyone they can come back every year. Yeah, I never discharge anyone. Blooming Interior. So whether or not you come back every year, there's always an open appointment. So if I haven't seen you for a while, just get in touch and I'll see you. But if if you want a yearly thing, yeah, we do it. We do a yearly thing. I like the yearly thing just to keep an eye on people. But yeah, definitely come and have a look. Star. Oh, hold on a minute. Hold on a minute, Stargazer. Liz, I've booked to have MLD. That's a manual lymphatic drainage. Um, after my boobs in November, I just like massages. Liz, I think there's something that I'm with you on that, and I don't want to sort of upset any manual lymphatic drainage people who say we're not just massages, we're medically and all that sort of stuff. So there may be more to it. I'm not saying there isn't more to it, but even if there isn't more to it, it's a nice feeling, isn't it? But yeah, I don't know a huge amount about it, but I'm glad you said it, Liz, not me, right? Because I don't want to get in trouble with the MLD people, but I think it probably is a nice thing to do, and maybe there is some evidence to say that it does aid healing. Stargazer, have you ever heard of a bottomed out implant migrating back up because of capsular contracture? I had a bottomed out implant with all the classic indicators. 3 surgeons also confirmed this, but now 8 months later, it seems to be sitting high and the incision is back on the IMF. Not this specific sequence of events, Stargazer, a bottom out implant migrating up, but I guess thinking about it, it could, because a capsular contracture does make the implant sit high. So I guess if you've got an abnormally low implant, a capsular contracture might actually bring it back to a normal position. It's not outside the realms of possibility. So often if you have 2 implants and one of them develops a capsular contracture, it can sit high and it can look a bit odd, the capsular contracture one. So if it was looking odd and low before, I guess there's an option for it to sort of sit high and be going back to the normal place. So I've not heard of it, I've not seen it, Stargazer, but in principle, in theory, I can see how that might happen. I've got a little one with a question mark here. Oh, what is your opinion on? Oh, there you go. That's a wellness therapy asked a question through the appropriate channel. I'm not quite sure how that. Oh, thank you. Let me check. Running out of questions here, not going to lie, NGL. But if you have, thanks very much. Thanks for asking the questions, Stargazer, because I am low on questions tonight. I've got to be honest with you. I've got 2 more, full disclosure. So if anyone's got a real question they want to answer, then fine. But I got 2 in the bag, but that's it. As I said earlier, I'm sure we had more questions this week, but there you go. I've got 2 left in the bag. Now, number 1 question is this: what is gynecomastia? Oh no, sorry. Why is gynecomastia surgery so expensive? Fair question. Now, this comes, I think, from the fact that the problem with gynecomastia surgery and with other surgeries as well, where there's sort of a range. When you book the surgery, you pay for gynecomastia correction headline. So if you've got a very mild gynecomastia, which is sort of basically man boobs, if you've got a very little bit of tissue behind the nipple, or you've got quite extensive gynecomastia, there's quite a range for which the price will be the same. So that's problem number 1. You're a bit at a disadvantage if you've got mild gynecomastia, because you feel like saying, oh, I've got a mild one. Can I have a, we don't have different grades for gynecomastia. We've only got grades for, but two grades for gynecomastia, which is basically gynecomastia correction with lipo and excision, liposuction and excision. That's the standard treatment for gynecomastia. And then we've got a skin excision price where you actually remove skin and give a big scar, and that's for significant gynecomastia, which is only rarely performed. So that first category is quite a large group of patients, and I understand how someone who's got a very mild gynecomastia might look at the price of gynecomastia correction and thinking, "You are having a laugh, mate. What are you trying to charge me all this money for?" Totally understand that, but that is number one. And number two thing is I I wouldn't say often, but sometimes see patients who say, "I just got a bit of this behind the nipple. Can't you just cut that out?" And what they don't realise is if I just cut out the glandular tissue behind the nipple, I'll leave a dent. It's called a crater deformity. It doesn't look good at all. And so when you do a gynecomastia correction, you have to contour the whole chest, the whole shebang. And that's where the lipo comes in. So you have to lipo all this area. And lipo is expensive. The equipment's expensive with lipo, so it is expensive. You have to lipo all this area, and then you take out the gland behind the nipple. So if you just take that little button behind the nipple, that little gland behind the nipple, there's a risk that nipple that might sink in and give you a crater deformity, which is actually quite difficult to correct. So I would contour the whole chest area. So it's often more than you think, even though you think you just got a little bit behind your nipple, number one. And number two, it covers quite a wide spectrum. And so someone with mild gynecomastia might feel aggrieved at the cost. And I can completely understand that. And do you know what? Life is expensive these days, isn't it? I'm finding that. Everything's expensive. Aren't you finding that? Everything's expensive. I don't know how people survive. It's just expensive. Stuff's expensive. Anyway, separate issue, perhaps for another day. That discussion. I've got to be honest. Liz is holding up the chat. I mean, Simone did well early on, but Liz is holding up the chat. Well done, Liz. Is muscle repair done that? I've done that. I've got a tummy tuck question. How does it work? I like my tummy button. Will it look different after TT? Yes, it will, Liz. It will look different after TT. So you have to be prepared for that. I'm assuming we're talking about a full TT here. So a mini tummy tuck, it still will look different. It'll just look pulled down a bit. But a full tummy tuck, all of the skin from your tummy tuck down to your mons area, I don't know if you've got a cesarean scar down to where the cesarean scar is, all that skin is removed. Now, if we did nothing to your tummy tuck and just if you did nothing to the belly button, your belly button would end up down your pubic area and it would look odd. So we can't have any of that. So what we do is we cut around the belly button. The belly button then drops in. All of that skin gets removed. The skin from your belly button up to your rib cage then gets pulled down. Your belly button's underneath the skin here. And then we make a little hole in that skin, which was up here, and pop your belly button back through again, and you get a scar around the belly button. I don't know if I've understood. I don't know if I explained that all right, but I feel like I need a graphic or something. But basically, it is your belly button still, but the skin around it will be different. Will be skin that used to be up here. It's really easy to see if someone's got moles and things in their skin in their upper abdomen. Those moles all of a sudden become pulled down and sort of end up below their belly button when the mole was above the belly button, because that skin gets pulled down. So it is still the same belly button, but the skin around it is different, and you'll have a scar around it. So if you particularly like your belly button, yes, it will be different. Although the actual, again, if you had a mole inside your belly button or something distinctive inside your belly button, that's still your belly button, but the surrounding of the belly button is different, and it is a thing to make your belly button look good. Believe it or not, Liz. Yeah, it is. It's a thing. This is the thing about plastic surgery. We make a fuss about all sorts of things. There are papers written, and I've written one. Yeah, I've written a paper about how to do this. And when I wrote the paper, I researched it, and there's loads of papers written about how you do the belly button. So there is an art and there is a process for actually getting the belly button to look right from the shape of the belly button, from the shape of the scarring that you cut out, from the tissues around it, to try and make it sit in a dent within the central abdomen rather than just having a flat belly button. You have to try and let the abdomen go in to make it sit within the dent. Nice superior hood. So there is something about making a belly button, but yeah, it will be different as I say, it's still your belly button side, but if you like the aesthetic around it, it'll be different. But the part of the surgery is to try and recreate a nice aesthetic for the belly button. So that is, Liz has seen some dodgy ones, although yours are pretty amazing. There you go. Well, that's kind of, I'm glad you haven't seen some dodgy ones in mine, but yeah, it is a thing, the belly button, and I think you have got to work hard at making the belly button good because it's a very important landmark on the abdomen. So you can't skimp on your belly button when you're doing a tummy tuck, but yeah, it is a thing to try and make them look good. Faux show. So what's going on here? Stargazer. Can scars from an uplift be worsened after babies? Will they most likely stretch and look awful afterwards? I wouldn't say so, Stargazer. Do you know what, Stargazer? That wouldn't be my worry if I've had an uplift and I'm having a baby. My worry is about the breast shape, to be fair. The scars probably won't stretch. No, I think presumably they're mature scars, I'm presuming. I'm presuming you wouldn't have had uplift anytime soon before having a baby because you would have deferred it. So I'm presuming they're old scars. I don't know if that's a fair assumption or not. But my main worry, Stargazer, if you're going to have a baby and you've had an uplift, is that the skin will get stretched. And that's a bit of a problem because you spent all this money on your uplift and then your breasts might droop again. So I wouldn't worry too much about the scars, but the breasts might droop and that might be an issue. But let's face it, you've got a baby, so look at the bright side. But those babies can do things to your breasts in terms of the shape. So that's what I would worry about more if I was having a baby after a breast lift. Oh, here we go. Look at this. This is all seamlessly running in. Can I breastfeed after a breast reduction? I get criticised. To be fair, you wouldn't think it, would you? You wouldn't think they would take pot shots at someone of my caliber, but I do get criticised for not for waffling. I know, I would have thought it, and for not giving straight answers. But do you know what? This stuff is not it's not always straightforward. So, can you breastfeed after breast reduction? Maybe. Maybe. That's it. I can't give you a straight answer. It's not a yes or it's not a no. Number one, you might not be able to breastfeed now. So that's the first thing, especially if you had no children. So you might not know whether you can breastfeed or not. Some people can't breastfeed. So assuming you can breastfeed now, when you do a breast reduction, you do isolate the nipple on what we call a pedicle. So you have to isolate the nipple and you do the breast reduction around it. And that pedicle covers a blood supply and a nerve supply. And we've got to hope you've got enough blood supply and nerve supply in that to keep the nipple alive, because the nipple can die if there's not enough blood supply, and to keep enough nerve supply so the sensation is normal, because sometimes you can get alteration in that sensation in the nipple, but also to keep enough milk ducts to the nipple so that you'll be able to breastfeed. When we're doing the surgery, we can't see the blood supply, the nerve supply, and the milk ducts going to that nipple. We just keep a stalk of tissue and hope it's big enough. You can see the nipple, you can see it's pink, and you just hope it doesn't start going not pink, because that means your blood supply is altered. So you'll see pretty quickly whether the blood supply is altered. But you can't see the nerve supply and the milk ducts. Often there's odd sensations afterwards, so the nerves get pushed about, but it takes about 6 to 12 months for those nerves to come back to life. So you're not going to know whether you can have normal sensation for 6 to 12 months. And in regards to the milk ducts, you're only going to know when you start to breastfeed, really. There's no way of testing or knowing. So it's unpredictable whether you'll be able to breastfeed. You may be able to, you may not be able to. It depends on how many ducts are in that stalk of tissue we keep attached when we do it. And what I would say is so the other thing about breastfeeding, going back to the last question, is that if you are thinking of having children, that can affect the size and shape of your breasts. So you're probably better waiting if you are considering having children before having a breast reduction, because it might sort of mess up your breast reduction. And the second point, there was definitely a second point. Size and shape can change if you're having children. Can I breastfeed after a breast reduction? Yeah, wait, I've forgotten it. Anyway, so first thing is, anyway, I forgot. First thing was, can I wait? Wait till you have finished children. Anyway, gone. So yeah, unpredictable. That's the answer. Right, that was a good. That's the last question as well. That's a bummer on the last question. I choked on the last question. There was another point I was going to say. Anyway, if you've got a question, I'm sure I've had more questions this week, but I haven't put it on the list. So that's all the questions I've got this week. Been a nice day, isn't it? Nice weather. Barbie weather. I bought one of those chimneys, to start the Barbie when we had the last sort of heat wave. I haven't used it yet because it's rained ever since. Nice weather now. Big clinic tomorrow though. I'll be able to do it tomorrow, maybe at the weekend. What's the forecast the weekend? Fingers crossed. So yeah. What's that other part about breast reduction? Breastfeed after breast reduction. Oh, here we go. What's going on? Maxine, hi, Maxine. You got a question, Maxine? Simone, ask me a question if you want. But Simone's coming back next Wednesday, so I will see you next Wednesday. Cannot wait. Big day next Wednesday, Simone. Big day. I'm on Weetabix that morning. So anyway, I'm going to check out because I am a busy guy. I can't just sit here all night. I am a busy guy. Yeah, I've got things to do, TV to watch. So I will see you back next Tuesday night. Simone, you need an early night next Tuesday night. So do I. So we'll have an early night next Tuesday night, but I'll do this and then we'll straight to bed. Obviously, Anyway, and I will see you 7 o'clock Tuesday. Good luck, everyone, on Thursday with the results if that's relevant to you and your family. And I will check out of here. Good night.